Miriam, my name's Kaylee. I'm your nurse for today. I've just read over your notes and it says here that you're due for some pain relief. Can you just tell me a little bit about your pain before I get that for you? So where is it located?
It's on my side, near my ribs.
Yeah. And how bad is the pain on a scale of 1 to 10? 1 being not so bad and 10 being the worst pain you've ever experienced?
It's probably an 8.
Okay, so it's pretty bad. And how long have you had the pain?
For a few hours now.
Okay. So the pain relief I'm going to be giving you today is going to go through your cannula here on your arm. Do you know when that cannula was put in?
I think it was this morning.
This morning? Okay. And it doesn't hurt at all?
No, not at all.
Not when I touch it?
Nope.
Okay, so there's no redness, no swelling, and there's no heat, so I'm happy to use that. Just before I get your analgesia ready, could you just tell me your name and date of birth?
Marion Adib.
Yeah, and your date of birth?
The 7th of January 1969.
Perfect. And your MRN is 174963, 174963. Perfect. Do you have any allergies, Miriam?
No, not that I'm aware of.
Okay, so what I'm going to do is I'm just going to do observations and then I'll come back with your PCA. Is that okay with you?
Yeah.
Perfect. I was just wondering if you could validate this order with me. Yeah. So we have Miriam Adib. This is all her details, which I've checked with her and with her wristband. They're all correct. So Miriam's having some morphine, 50 milligrams in 50 mils for her fractured ribs. So it's an IV narcotic analgesia chart. The concentration is 1 milligram per mil with a total of 3 syringes. The PCA dose is 1 milligram with a lockout interval of 5 minutes. And the hourly dose limit is 12 milligrams. So the doctor's signed it here and it's all legible. Yeah. And she has no known drug allergies. Good. Do you agree?
Yeah.
Yeah, thank you. Okay, so just checking the morphine here in the MIMS. So morphine is an opioid analgesic used for the treatment of chronic severe pain. Some contraindications are opioid hypersensitivity, acute respiratory depression, obstructive airway disease and acute asthma. Adverse effects are respiratory and circulatory depression, hypertension and sedation. So we'll be monitoring Miriam's respiratory rate and also her levels of consciousness. So the dose is, it says here, 0.5 to 1.5 milligrams per PCA dose, which is what we have ordered. Okay, so this is the injectable drugs handbook, morphine. So IV infusion, so it says dilute to the required volume in a compatible solution. So compatible solutions, here we have sodium chloride 0.9%, which is what we're using, so it's compatible. Okay, so I'm just going to get out Miriam's morphine. Okay, so we have morphine sulfate injection 10 milligrams in 2 mils. Yep. Okay. So we have morphine, 10 milligrams in 2 mils. Okay, so it says here before they had 25, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, so that's 20. 1, 2, 3, 4, 5, so 25 is there. I agree? Yeah. Okay, so Miriam's ordered 50 milligrams in 50 mils. So we're taking 5, so 1, 2, 3, 4, 5, and that's 50 milligrams. So it's leaving us with 20 left. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do you agree? Yes. So that's 20 altogether. Do you just want to sign that with me? Okay, and then we'll put these back. drug check with me as well now?
Yep.
Okay, so we have Miriam Adib. Date of birth is the 7th of January 1969. Her MRN is 174963. So I've checked all these details with her and they're correct. She has no known allergies. So it is dated for today's date. It's morphine 50 milligrams in 50 mils. So here we have 50 milligrams, morphine sulfate 10 milligrams, and we have 5 of them. So we have 50 mils. So it is signed and printed by the doctor. It's a legible order. And so the drugs, they expire in 2020, so 10th of 2020, so October 2020 for all of them. Do you agree?
Yep.
Yeah. Okay. Okay, so I'm just going to gather my equipment. Ellie, would you mind checking the sodium chloride with me that I'm going to use to prepare the drug?
No worries.
Okay. So we're using, just put them all out so we can see them all. So we've got sodium chloride for injection, it's 0.9%. It expires 2018. Sodium chloride for injection, 0.9%, 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 2018. And they're all 10 mils. So we're going to be using the 4 of them.
Yeah.
Yeah,
Perfect.
thank you. Okay, Ellie, would you like to just come check with me that I've got the full 10 mils?
Yeah.
Okay, so we've got 10 mils of morphine.
Yep.
Awesome. Okay, do you just want to come check that I have the full 50 mils?
Yeah.
Okay, perfect. Lee, if I could just get you to sign my intravenous sticker and do my second drug check with me.
Yeah, I'm happy with that.
Okay, so here we have Miriam Adib's IV narcotic analgesia chart. So her date of birth is 7th of the 1st, 1969. Her MRN is 174963. I've checked these details with her and her wristband and they're all correct. She has no known drug allergies. So she's ordered morphine, 50 milligrams in 50 mils. It's for today's date and time. It's signed and printed by the doctor here and it's all legible. So here we have the 50 milligrams which I've prepared. Do you agree?
Yeah.
And we'll just check these as well. So these are all morphine sulfate, 10 milligrams in 2 mils. So morphine sulfate for all 5. They all expire in 2020. Do you agree?
Yeah.
Yeah. And this is what I use to mix the drug with. So it's sodium chloride, 0.9% for IV injection. It's 10 mils and it's 2018 and they're all the same. Do you agree?
Yes, I agree.
Okay, thank you. Okay, so that's primed. So we've got morphine, 1 milligram in 1 mil. So 1 milligram. Lockout is 5 minutes. Max infusion is 12 milligrams per hour. PCA dose 1 milligram. So I'm happy with that. Okay. Change the type of syringe. Okay, and that's ready to go. Okay, would you just like to do my third drug check with me? Yep, so we've got Miriam Adib, date of birth 7th of the 1st, 1969, MRN is 174963. I've checked these details with her and her armband and they're correct. She has no known allergies and I've checked that with her. So this is her IV narcotic analgesia chart. She's charted for morphine, 50 milligrams in 50 mils. It's for today's date and time, and it's signed and printed by the doctor. Do you agree?
Yep, I
Yep.
agree.
Okay, so here we have the morphine sulfate. So I've got 5 10 milligrams, so equaling to 50 milligrams. They all expire in 2020. Do you agree?
Yep.
Yep. And I've mixed the drug with this sodium chloride for injection, 0.9%. It's 10 mils. It's for IV injection, and it expires 2018. They're all the same. Do you agree?
Yep.
Yeah. Okay, so I've just set up the PCA. Would you like to come check that with me? Okay, so here we have on the PCA, we have morphine, 1 milligram in 1 mil. The lockout, so here we have 1 milligram, 1 mil morphine. PCA dose is 1 milligram, 1 milligram. The lockout interval is 5 minutes, 5 minutes, and the hourly dose rate is 12 milligrams. So I've put that as the 12 milligrams.
Yep.
Do you agree?
Yeah, I agree.
Okay. Okay, so we'll just check Miriam's ID again. So Miriam, can you just tell me your full name and date of birth?
Miriam Levy,
Yeah, Miriam Adib, and your date of birth, please.
the 7th of January 1969.
Yeah, and your MRN is 174963, 174963, perfect. Do you have any allergies?
No, not that I know of.
Okay, perfect. So what I'm going to do now is I'm going to connect your PCA, and I'll explain a little bit about it for you. Okay, Miriam, so I'm just going to swab your cannula for 15 seconds to make sure it's clean. Okay, Miriam, so what I'm doing is I'm connecting your PCA. So PCA is a patient-controlled analgesia. And what it is, so I'll give you a button to press, so you control your analgesia. So that once you press the button, it will deliver you some morphine, and you can press the button at 5-minute intervals, and it will deliver it to you. So if you press the button within the 5 minutes from the first one, it won't deliver it. You have to wait the full 5 minutes before you are delivered another dose. Is that okay with you?
Yeah.
Okay, let me just take my gloves off and I'll just take that securely. Okay, Miriam. So this is your button to press. So you can see now that the light is on. So when the light is on, you can press the button and it will deliver you some pain relief. I'll just give you your buzzer as well. So if you need me, I'll be back within about 15 minutes. But if you need me in the meantime, just press your buzzer and I'll come straight away. Do you need anything else at the moment?
No, I'm alright.
Okay, thank you. Do you just mind signing this chart with me? So I'm just going to sign it here. So just write today's date. Okay, thank you. Okay, so I'm just going to dispose of all my rubbish. I'll just put that in the bin down here. And I'll take these needles to the sharps bin.